What does it mean to have HIV today after years of research and advances in treatment? It means you can have a normal lifespan and have a similar life to someone who does not have HIV. Hello and welcome to this episode of The Last Mile with NACA. I am Adesuwa Osui. It used to be 20 pills a day. Now, people like Paul Adamu take just one pill, an antiretroviral treatment that makes the virus undetectable and untransmittable to others. You're watching The Last Mile with NACA. Don't go away.
You've probably heard of the phrase, HIV is not a death sentence. And yes, a positive HIV diagnosis is not something to be taken lightly. But with modern treatments, though no cure, people living with HIV today can live long and healthy lives. Perhaps Paul's story as a person living with the disease, a father and a case manager, would help drive home the essence of that phrase.
My name is Adamu Paul. Yes, I am a person that is living with HIV. Maybe it's now clocking to 16 years now. I am working in Bosham Hospital as a case manager. Case managers are those people that takes care of the HIV patients. And they do adherence and counseling. They supply the drugs and whatever assistance they need. They will answer questions, then we try and solve all the services. We are the one giving them. I married my wife traditionally, and we don't even know anything about HIV. I don't know it. Talk less of asking questions. So gradually, we come to a certain point that she was sick. We don't know. And she was not pregnant at that time. So rashes appeared. So I took her to the hospital and they tried it, they see. Say, okay, well, we don't understand it, but let us see what we can do. But the doctors went in, took her, they do tests, and they got, she is positive. Well, they gave her drugs, they did not ask me anything. Later, they called me. Oga, come here. I just come. They say, please, can you allow us to do a certain trial on you? Because your wife, there's something that we want to understand. We don't understand that until from you. Please, can we try that? I said, okay. We went in and I was tested and it was found that I have. So he explained that this is that. How manage? He just cooled me down. It's just doctors only, no case manager, nobody. He just advised me, hold my wife tightly, don't play. I said, it's okay. Since we have already gone into it, let us remain together.
Like most couples living with HIV, the question came up, what about the baby?
When she was pregnant, I took her to the hospital. And normal thing, if they see the file, they know that this is that, okay? So gradually, they advised me I should handle her with care. I should not treat her like the way an ordinary wife should be treated. I said, okay. So I will took her myself for antenatal. We'll come back together. Always we go together and come back together. So gradually, the time of delivery comes. Then I asked a question. Before then, I asked a question. What of this child that we have, that is here now? They are sharing the same blood. How can you say, what will happen to the child? The doctor said, nothing will happen to you. I say, how? They are connected. So how? Please explain. They say, no, there are some things that they will give and it will separate the disease from even the baby. The woman is taking some drugs that for the antenatal, so it will not connect that thing with the child. I say, okay. Gradually, she was delivered, okay, and they treated the child. They gave her the child nevirapine because it's a male that is first. And we tried with time, after 6 weeks, we tried, and they say it's negative for now. I say, for now, it's okay, I agreed. We just went. We will come back when the child is being weaned. We came back and the child is negative. He said, that's all. The child will not have that thing again, but we should be careful with cutting items. We should not use the same material and touch the child with. Say, okay, thank you. From the first one, the same process had been followed and everything is normal. Okay, we continue with the second throughout, gradually up to the last, up to the 5th child now. All of them are free from HIV.
His experience with HIV-related stigma made him decide to help others that have been newly diagnosed with HIV cope better with the new normal.
When I come, they will be looking at me as if I am not human being because I have that type of a disease. So gradually, I come to understand things that this group of people needs care. When I was just teaching, somebody called me. You told me one day that you have interest in this type of work. Can you please come over? One doctor. So he just called me, I come. He said, can you do it? I said, I can do it, sir. Just like that. Okay, you can start tomorrow. As simple as that. When I came in, they trained me a certain way. They told me what to do, this is that, this is that. Then I said, okay. That's how I started the work.
Of course, as a case manager, Paul counsels both male and female clients. He also handles a special group, pregnant women.
I counsel male and female. As they come in, anybody that comes, all, it belongs to me. When the woman comes for antenatal, now, they will say there are some tests that you're supposed to do before we go into maybe whatever. Now, when they come up with that, they will say, the doctor will advise her, say, we have this in you. And it is, the name of the disease is called HIV. So please, we want to connect you with somebody that will guide you on how to, then they will connect us. The doctor will now call me, please, we want to adhere, counsel this woman on this and this. Now, if I will take her somewhere, we'll sit down together. Sometimes, the woman, I will just meet her crying. Say, what is happening, my dear? Say, this is what the doctor told me now. Say, it's okay. It is not a disease that kills. Now we have a remedy for that. Please cool down. Let us see what we can do. I will advise her on how to take drugs, on how to do whatever that is needed for her. And her child will come out from the pregnancy without any difficulty. The child will never have. That is the truth I will tell her. I will now connect them together, husband and wife. I will ask them to come, that this is what has happened. Please, we should join hands together. Do things together. Do whatever you do. Don't miss this drug so that to protect the child that we have. That's how we do.
Given his opinion of why women account for a disproportionate number of new HIV infections, Paul urged men to support the HIV response.
The problem there is a man can marry a wife, and some men can marry 3, 4, and he alone can supply this to them. That's why they are more than the men in number. All right? So the men should please take note of this. They should not be allowed or spread the disease to others. Let them hold to themselves. If you have one wife and the two of you are only having, please stick to each other. That's the best way of living. Don't go out and do other things because that is spread. Men should always go and check themselves before even marriage. Okay, tests supposed to be done. So before then, you should know your status. Go and test yourself so that you know that you are this. Yes, it's the best way of living.
Again, as stated earlier, HIV is not a death sentence, unlike a few decades ago, but is a manageable condition. This is evident with Paul Adamu even going on to have 5 HIV-negative children.
They go like this now. Take am easy now.
Now hospital I dey go to do HIV test.
Now everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Na make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin.
Yes o, during pregnancy or labour or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sentence. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word. The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols, wear a face mask, and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria.
As stakeholders work to end the epidemic and to find a cure, we must continue to fight negative ideas such as HIV is a death sentence or a person is HIV positive because they did something wrong. Because none of these are correct. Update segment is next. Don't go away.
A send-off ceremony was held by the NACA management for the outgoing projects coordinator of the Global Fund Resilient and Sustainable System for Health program, Dr. Ibrahim Jahu. Expressing appreciation, Dr. Aliu Gambo commended Dr. Jahu for his work in Nigeria.
This is an opportunity to thank Dr. Jahu, for steering the ship for the last 12 months and for making sure that, we've at least not failed. We've absorbed, and we have absorbed appreciably well, by Global Fund ranking. You remember last year, they sent a video all the way from Geneva thanking Nigeria, for the work Nigeria has done and for getting us there. And they're not thanking Nigeria because of what is happening with other PR. They're thanking Nigeria because purposely what NACA has achieved, because NACA held the bulk of the grant, that was implemented last year, especially with COVID-19 and RSSH, and as well as HIV. So this is something, that all of us here should be proud of. So we're coming together today to tell Dr. Jahun that we thank him and we appreciate his dedication and hard work and his leadership up to this moment. And we're wishing him well now that he is seeking to establish a dual career that enables him to combine academics and program.
There were several goodwill messages by those who have worked closely with Dr. Jahun.
He sets goals and he works towards those goals, no matter how difficult it is. He set those goals for himself and he also sets for us. And when we have issues meeting those goals, he provides all the kind of support you need, even without you knowing. You just come to the office the following day in the morning, you find out that some of those challenges are already sorted out. And you're like, how did it happen? I also know that when there are difficult decisions to make, he doesn't shy away from it. And he takes those decisions. And that's what is the quality of a good leader. And I sincerely appreciate you for doing that. And I know we miss all those things, and we also try to build on the legacies you've started.
Dr. Jahun is definitely a strong leader, and he's always been a present leader. He's one that gets into the trenches with his staff, and everybody sees that. He's very, very much savvy and very clear about what he's there to achieve, and he just doesn't stop in terms of putting his energy and efforts to ensure that we succeed as a team, and that's something that we all see and we will miss. Dr. Jahun, you've been amazing as our project coordinator. We're sad that you are leaving, but we're also happy for you because you're moving on to something that aligns with what you wish for yourself and for your career, and we will continue to pray that you succeed in what you're going ahead to do. I join everybody here to say it's been a true gift working with you, and wishing you all the best for the future.
Jahun is quite a meticulous, articulate and affable gentleman who I know carries out his duties and functions with passion and immense commitment. I think it is saddening to know that he's leaving the RSS project because the project is going to lose quite an engaging servant leader, one who is result-oriented, but we do know that as you leave, you are leaving for higher goals. You have worked with us, you know our systems, and so you have become like a NACA ambassador. You have left your tray here, and I do know when the history of RSS is written, your name will be written in gold. We wish you well in your future endeavors. Continue to have NACA at the back of your mind, and like one of your staff said, you are on loan, and our paths shall still cross. Thank you very much.
In his response, Dr. Ibrahim Jahun thanked NACA for the gesture.
Today for me actually is a very memorable day because I've never expected such kind words from all of you here. Yes, working with NACA for me is a special privilege and opportunity. It has been 12 months of learning. Even though you've said I've done a lot, but I think I benefited more than anybody working with NACA. For my team, the PMU, I think is really a very, very great team. There are a lot of potential there. I learned so much from all of you. And I'm very positive also that I don't have any doubt that we are going to excel. So thank you for the opportunity to serve in NACA, and have accepted, and I'm privileged to be part of NACA family, and I will continue to be part of NACA family. Thank you so much.
Highlight of the ceremony was the presentation of gifts and cutting of cake.
A major challenge facing HIV control in Nigeria is the growing number of people living with the virus but are yet to learn about their HIV status due to fear of stigma and discrimination. HIV self-test kit is a simple, effective, and quicker way of learning about your HIV status in the privacy of your home. The test can be performed using saliva by rubbing the outer part of your upper gum, followed by the outer part of your lower gum with a flat pad, and then dipping the flat pad into a buffer tube to wait for 20 minutes for the result to read. For more information, contact our call center at 6222 or NACA's website. Our services are available to you Monday to Friday every week. What we want people to know is that there is an act against HIV stigma and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a number one enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center, toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching, and as always, continue to support the HIV response. Do not stigmatize or discriminate people living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week on The Last Mile with NACA, I am Ade Sewelsi. Goodbye.